welcome to Doggy Style TV. So you are a chiropractor for the human variety.
Yes.
And also for animals.
Yes.
All animals or just dogs?
I do, well, basically anything that has a spine, I can adjust it, but I mostly see dogs, horses, and cats.
That's excellent. And you've been doing this for how long now?
This is my 5th year.
Now, a lot of viewers are probably thinking, well, I don't go to chiropractic care. Mm-hmm. Why would my dog?
Well, for a lot of the same reasons, but if you've never been as yourself, then I would say the biggest things that normally come to me are sore backs and lameness issues. So anytime a dog is limping, it could be something in the leg, but a lot of times it's, you know, a hip joint or up in the spine, and can cause some discomfort for the animal.
Well, all he knows how to speak, you can hear.
Yes.
And he actually he does limp, and he does have arthritic, small arthritic condition.
Yes.
As well as some hip issues. So I guess maybe we can see you.
Absolutely.
Kind of do a little treatment on him.
Absolutely. Now, how old is he?
He's actually 14.
Oh, you're an old man, eh?
Yeah, he's getting there.
Hey.
And he's had a couple of small little accidents. I adopted him when he was younger. So before I got him, he was run over by a car. But the interesting thing was that, thank God, nothing happened to him, more so than I think it just affected his joints in a couple of spots.
Yeah.
But he's been amazing.
Good.
Since, so it's...
Well, I noticed he has a nice little wiggle to his butt when he walks.
He does.
There. So
That's probably his...
hey, you.
Larger sized. She's a Shih Tzu, 24 pounds.
And he's fairly long in the back, which is also something mechanically that's difficult for dogs. Is the longer they are in the back, the more gravity pulls at the center, and because if they have shorter legs, it's that much more difficult for them to hold that up nice and strong. So as they age, you start to see that droop in the spine. So
actually, we were very fortunate. I mean, we did some x-rays on his entire body, of course, a couple of times, and his back, thank God, is not arthritic whatsoever.
Good.
So that's a really good thing. Yeah, it's mostly his left front leg.
Okay.
And but you'll see. I mean, let's see what we can
find. Okay, but
Definitely.
I'm gonna start at the back end. That's just my. Sorry,
nice.
bud.
It's okay. There you go.
Get your bum end. Perfect.
He's used to this.
Perfect. So I usually start by observing how they walk, which I did before we got started here today, and then I usually have them standing. Can I get you to stand up here, pal? He says, well, I don't know. And I look at, the levels of their pelvis to see if they're fairly even side to side. Oh, you're a wiggly one. You're a wiggly one.
Ollie, relax.
And then I always like to check the sacrum as well when they're standing. And I like to see how well they stretch their hind legs at the hip. Good boy. Very nice. Okay, can we do the other one?
Good boy.
I know, bud. I know.
Do owners usually hold the dogs with you? I think
usually, yeah. Usually they'll take the front end and I start at the back, and then we do a switch partway through the treatment. So I'm just going to scoot over here, and then I like to do sort of an overall feel of the spine, see if there's anything major, lumps, bumps, that sort of thing. Anything that's twisted that comes out fairly obviously.
So technically, what is it when they say you're adjusting?
Yes.
What does it mean exactly?
Okay, so an adjustment is helping to create or restore normal motion in a joint. So joints, especially in the spine, are made to move. We like to say that motion is lotion. So when they're not moving well, it creates discomfort, irritation, and then muscles will tighten up around the area, and it kind of perpetuates itself. So the more stiff the joint is, the more stiff it will be, unless we can kind of break that cycle.
Exactly.
So that's what we're looking for, is to restore motion to those joints, and it helps them feel better. Helps the blood flow increase in the area, gets the fluid inside the joint lubricating so the surfaces can move against each other well. And that, generally speaking, makes things feel a heck of a lot better.
No doubt.
So,
no doubt. I mean, definitely. I mean, on people, especially, a lot of people don't feel their aches and pains, or they don't really know what's going on until they actually go to a doctor or get adjusted.
And I would say that awareness comes too. So if someone, say a person comes to see me and they've never been to a chiropractor before and they have a sore back, they will start to notice a lot more once they get a little bit more educated about it. Then they start to notice things more, and then they can nip some things in the bud that may have otherwise caused them a bigger problem.
Absolutely.
So, and I like to check at each spinal level as I go up, and my habit is to start at the bum, but that's not always necessary for pups. Everyone's got their own style.
Good boy, Ollie.
And so what I look for is restricted movement, heat coming from the area, and any tenderness. And usually they'll let me know if they're tender. Either their whole back will kind of flinch, or they'll start looking around and going, "What are you doing back there?" And you know, getting kind of nosy about it and seem uncomfortable.
Because they have no idea.
That's right.
Until it feels good.
That's right.
And especially if they're already sore.
Correct.
So, you know, why they're probably thinking, why are you touching that sore area?
Yeah.
Have you ever been bit by a dog?
Once, not badly, and you know, it's sort of occupational hazard, but generally we're really well trained in safety too, to keep ourselves safe and the owners safe, so it really doesn't happen very often.
That's awesome. How's he feeling?
Not too bad. What I'm noticing mostly for him is right in sort of the central part of his back, where he transitions sort of from the thoracic vertebrae into the lumbar vertebrae. So they have 2 or 3 segments here that do both what the thoracic spine is meant to do and what the lumbar spine is meant to do. So it bends and twists. So it's flexible.
Cool.
But with flexibility comes less stability. So it's a space that you'll see compensations crop up very often. And so far that's all the excitement that I've found with him, which is pretty good for an old man here.
Yeah, he loves to walk.
Well, and that's important too, and exercise helps keep them trim, and being a healthy weight is really important for the joints. It's amazing how, the difference of 3 or 4 pounds can make them so much more comfortable with their joints, because there's not so much weight carrying through.
It's really strange. He really doesn't eat a lot, but he tends to put on weight. It's really strange. I've even I've checked his thyroids, absolutely no issues. He's just a thick dog.
Yeah, and some dogs are.
I guess. I mean, I've tried everything, and we walk 5-6 times a day. I mean, he's with me all the time too. So it's a little odd.
So the other thing I'm noticing, you had said left front, correct?
Yes.
Like his left shoulder area?
Yeah.
So in his lower neck on that left side, I'm finding some tension there. Not a lot of tenderness, but some stiffness, which doesn't surprise me if he's had any lameness issues on that left front.
And of course I massage him regularly too.
And that's really good.
Important, right?
Yeah, and I often will give stretches and at-home massage techniques for my patients to do on their dogs, for my clients to do on my patients. Because at-home care is important, and I find that the more hands-on you are with the dog, the more likely you are to find when things are starting to become a problem. So I always want people to be touching their pets.
Very important.
So, and sometimes dogs, we pat them on the head and we scratch them on their bum, and then we don't really get into it. So I find that it's an important technique or tool to learn more about your pet. But you can see as I put a little bit of pressure here, he twitches just a bit. You may not be able to appreciate on the video, but that's that area that I was saying is sort of through that transitional zone. So we will tidy that up. And it's perfect, buddy. It's on the left side so everyone can see. So normally it's very quick, generally speaking, gentle. If they're very sore, it might be tender for them, and there's no way around that actually, but it's fast, so it doesn't last long. It's brief, and they will feel better afterwards. Easy does it, pal. Just little, and all I'm doing is moving that joint in a range that's normal for it, but it's not going there on its own right now because it's stiffened up for whatever reason, pain, arthritis, tight muscles, whatever it is. So we'll just do a little, and that's it. Really? It's as gentle as that.
It's amazing.
Yeah, good boy. You're being very good, aren't you? And there's usually treats at the end of the tunnel too, so they learn very quickly.
That it's a good thing.
That it's a good thing. The other thing I notice is his muscles around his left shoulder are not quite as healthy and toned as they are on the right. So if he's had recurrent issues there, if he favors it at all over a long enough timeline, you're going to see just those muscles are not quite as strong, not quite as healthy and big and robust. And that's not unusual. That's sort of a normal response to just not using it quite as much.
He's not putting as much weight on it.
Exactly.
Is it what they call atrophy?
Yeah, and there's different things that can cause. Good boy. Now I got you there, easy. Good fella. There are different kinds of atrophy. There's disuse, which just means you're not weight bearing, you're not using it as often. And then there's neurological or atrophy that's due to lack of stimulation from the nervous system. So that's a more severe case, because disuse atrophy, as soon as they start using it again, always nice to see a full body shake after an adjustment. Once they start using it again, they can build it up. There's no neurological reason why they can't build that muscle back up. It's just because they haven't been walking on it. But that was great, buddy.
Yeah.
So he was really pretty good, you know, like he's a very healthy boy for 14. Nice to see.
Yeah, my babe. It is nice to see, and it's good. And I mean, of course, I do go for chiropractic care as well.
Yes.
And, you know, we do the massage, and of course, we have the, how do you feel about all the supplements? Because I give them chondroitin and the glucosamines. And
yeah, and there are appropriate dosages and details on what works best. I mean, just keeping up with what's current in terms of research. But there are some good supplements out there, and it's always, you know, something that I recommend people look into, and I can make suggestions on supplementation for joints and natural supplements for inflammation and things like that.
which is really great.
Yeah.
I mean, again, that's kind of the after they leave you care.
Yes, exactly.
You know, the owner has to do. In
Yeah,
order to
exactly.
keep a healthy pet.
Exactly.
And so typically, just so that our viewers know, what would they be looking at for an adjustment for a dog,
In terms of
cost-wise?
Oh, it depends a little bit where you are. I find, you know, if you're in the bigger city center, it's a little bit more expensive than if you're in a more rural area, and that's pretty typical of chiropractic offices in general. Everything's more expensive in the city. You know, you're looking at, for a first visit, I would say you're looking at between $60 and $80 probably on average, and follow-up visits are usually around $40.
Yeah, which is really nothing, right?
It's not that
It's like getting your dog groomed, even less than that, and you're actually doing so much good for them.
Yes, and usually if there's a complaint or concern, there's usually more visits at the beginning, kind of like dosages of medication. So you have, and it totally depends on the condition. It might be 3, it might be 6 visits recommended at the start, and then my ideal is I like to wean them down, and if they require a maintenance, somewhere between 2 weeks to 6 weeks every, you know, comes back for visits. So depending on the age of the dog and the condition, I like to just check in every month or so, give or take.
Well, you're absolutely amazing. I mean, that was so quick and easy, and I totally appreciate that. I know he does.
And clearly he's quite fine with that. And that's the thing that I think people are worried about, is that it's harsh or it hurts the dog, and that they're going to have to, you know, keep bringing their dog forever. And that's not the case. And I really encourage people to look into it more, because the more educated you are about it, the more you'll learn and see how it benefits your dog.
You know, and it really, I mean, you know, our company's selling shoes.
Yes.
So we see what happens to dogs in the long run.
Yes.
Right. So, for example, if they're running with their dogs and rollerblading, the dog's not having any shock absorption. Unless they put shoes on them, which is what we always say is so important. Again, you know, just to keep the spine healthy, to keep the bones and the joints, because as people progress, you know, people call me at the end of the dog's life at, you know, from 10 to 14 and say, oh my God, my dog has these issues. Well, what have we done up until then? You know?
And nothing.
Right.
Yes.
So you can't fix the whole whack of problems at that age, which that's why we always say, you know, an ounce of prevention is worth a pound of cure.
Correct.
Right? So
I agree.
Why not? Come in for the once every 6 month, once a year visit to the chiro.
Yes.
You know, massage your dog, make sure that he's healthy, because let me tell you, the problems, and I'm sure you see it all the time as well, the dragging paws, the DM, the hip problems, the arthritis, they are so taxing. And the sadness is that is one of the biggest reasons why people put their dogs down, right?
Yes.
Because they can't carry their dogs.
Their dog can't get around, and they can't get them around.
Right. There's no proper care for it at that point that makes sense to a lot of people. Yeah. Especially the bigger dogs, right?
Yes.
Because they see a lot of problems there, big time.
Yes. And they're hard to maneuver. Like if you have a small dog who has a bit of a limp, you can or pick it up.
Right, or pick it up.
But you can't do that with your 90-pound German Shepherd or
absolutely not. So
120-pound Great Dane.
Viewers, remember, take care of your pet, take care of yourselves as well, and give the same respect back and forth, and you'll have a happier, healthier life. Aerin, thanks a million.
Thank you very much. It was very nice to meet you.
Thank you. Just a wealth of information.
Thank you.
And Ollie thanks you too.
Yes. Great.
Good boy.